All right, let's now briefly talk about cachexia. So cachexia, what is it and what does it do to? So very briefly, so here we see, wow, a very wasted away patient with terminal cancer. And this is how often patients appear. They're often very thin, wasting, and gaunt, despite however much nutrition they're given. This is called cachexia, and it's due to chronic inflammation associated with cancer and the release of certain cytokines. Do you remember, or do you know, what is the specific and most associated cytokine with this condition? Tumor necrosis factor alpha. Also, you'll see interferon gamma and interleukin 6 around too, but particularly TNF alpha is associated with wasting and causing cells to just waste away. It induces apoptosis, actually. So no matter how much nutrition you give them, they're just going to keep losing weight. All right, now let's talk about some disease conditions associated with cancers. The first is this one. So this kid has a flattened nose and upward slanting eyes, a protruding tongue. What do you think this disease is? What does this poor kid have? Down syndrome. All right, and now what neoplasm is associated with this? Acute lymphoblastic leukemia. And the way to remember this is that we all, ALL, we all fall down. Down syndrome. Good. So know that one, pocket that away. What about this disease? What do you think this poor girl has? So she's very sensitive to sunlight, as you can tell by her sun-damaged skin, and she has extensive freckles and sunburn. So we know that she's sensitive to sun. What disease do you think she has, and what is the underlying molecular problem? Xeroderma pigmentosum. And what's the problem here? The problem is with DNA excision repair, especially after exposure to UVA and UVB light. So the light comes in and it alters the DNA of the skin cells so that there's pyrimidine dimers formed, and these individuals are unable to excise and repair these pyrimidine dimers, so they run the risk of skin cancers. Well, what types of skin cancers do you think they're at risk for? How about melanoma? One of the most deadly ones. And how do we know that this is a melanoma? Well, recall the A, B, C, D, E criteria. So the A stands for asymmetry. This is asymmetrical, right? Yes. B, border. Ill-defined borders. Some of these borders are sort of fading in to the outline skin. C, color. There's a bunch of different colors here. There should only be one. D, the diameter. It's a large diameter, greater than 5 millimeters. That's too big. And E is evolving, so changes over time. That's scary. Got to look out for the A, B, C, D, E criteria. Speaking of preventing skin cancers, the USMLE will often describe a precursor lesion to squamous cell carcinomas that's often found in the ear. We'll say like the ear or the arm of farmers. It'll be rough and scaly and erythematous in appearance. If the farmer scrapes it off, it comes right back. What is the name of this precancerous lesion? Actinic keratosis. Remember that. Good. All right. Here is columnar epithelium in the esophagus. That should not be there. It should be squamous. So this is Barrett's esophagus. Barrett's esophagus, recall, develops due to acid injury to the esophagus. So repeated exposure to acid and reflux from the stomach causes the epithelium to metaplastically change from the normal squamous epithelium to this columnar glandular epithelium to try to protect itself and coat itself with mucin. Remember, what's that called? I just said it. What's the name of that transformation? That was metaplasia. We saw it earlier. Where did we see it? In the bronchus of the lung. We talked about that. All right, so that's metaplasia. And remember, whenever we change from one adult cell type to another, we change the DNA of that cell. And changing DNA causes us to run the risk of cancer, right? Of neoplastic progression, because anytime you mess with the genes, anytime you mess with DNA, you could lead to mutations and cancer. All right, so that could cause what type of cancer specifically? esophageal adenocarcinoma. All right, what's this? Ascites, right? There's a lot of fluid in this person's belly. What's it due to, probably? Cirrhosis of the liver. Fibrous tissue in the liver is preventing fluid from getting into it, and it backs up and leaks out into the abdomen, so that's called ascites. What are common causes of cirrhosis? How about chronic hepatitis infections like hepatitis B, hepatitis C, or chronic alcoholism? And all this chronic inflammation from hepatitis over and over again can predispose an individual to what type of malignancy. So all these free radicals around can actually damage DNA and cause primary hepatocellular carcinoma. And you can see this here in this singular necrotic mass that's enlarging here in the liver. So that's primary hepatocellular carcinoma. We'll talk about that a little bit more later. What about an individual with AIDS? Okay, I didn't have one specific lesion for AIDS that it presents with. It presents with a number of things, so I just put up this ribbon here. But let's say a patient who has known AIDS with a CD4 count of 25, very low, presents with mental status changes, confusion, and motor sensory deficits. A head CT shows this. What is that? There's a ring-enhancing lesion right there. And first of all, what's the most common cause of a ring-enhancing lesion in an AIDS patient? Toxoplasmosis. Thus, you'd start them on treatment with what? Trimethoprim sulfamethoxazole. And if this toxoplasmosis is in their brain, then they will improve with treatment. But if it's not toxo, if it doesn't improve after antibiotic therapy, then you'd likely take a biopsy. And what would that biopsy show? If you could take a little sample of this ring-enhancing lesion that's not going away with trimethoprim sulfamethoxazole, what is it? Primary CNS lymphoma. And how would you treat that? Well, you'd start them on antiretroviral therapy, increase their CD4 count, and use their own immune system to shrink the tumor. So that's what you do. And in general, anytime the immune system is disturbed, like in people who are immunocompromised or with autoimmune diseases, there is a significantly increased chance of developing lymphomas. And possibly because CD4 T cells are part of the process of fighting off lymphomas. So you need to have these around to keep them at bay. So that makes sense. All right, what about radiation? Radiation, what is this associated with particularly? Well, we already discussed how radiation hydrolyzes water molecules, right? Turns H2O into hydroxyl free radicals. Very, very dangerous free radicals. And these can go and bind to DNA and disrupt DNA proliferation and cause all kinds of mutations and eventually neoplastic transformation. So the USMLE really likes the association between radiation and specific types of cancers. What in particular? Papillary carcinoma of the thyroid. For some reason, it causes this. Also, leukemias, breast cancer, and other sarcomas too. So know those. Flash quiz. What cancer is associated with ulcerative colitis? Adenocarcinoma of the colon. Good.